Welcome to the Explainer. Have you ever wondered what exactly happens behind the scenes after a doctor takes a blood sample or biopsies a piece of tissue? Well, today we're embarking on the ultimate medical detective story. We're diving into the thrilling, foundational science of medical investigation, pathology. This is the field where doctors literally act as high-stakes detectives. They're deciphering these hidden, microscopic clues our bodies leave behind just to solve the mysteries of disease.
Okay, let's dive into this with a quote. Without pathology, the practice of medicine would be reduced to myths and folklore. That powerful statement from Professor Aminu Zachary Mohammed absolutely hooks us into the immense gravity of understanding this field. Think about it. Before we had this science, treating illness was kind of just guesswork, superstition, and, well, hoping for the best. Pathology is exactly what brought actual, hard evidence into the hospital room.
Section 1. The foundation of medicine.
It's absolutely crucial to realize that pathology isn't just another subject you cram for in medical school. It's the literal bridge between raw science and treating actual human patients. Without it, those two worlds just don't connect. And this brilliantly illustrates that idea using the metaphor of the tree of medicine. Down at the bottom, deep in the dirt, you've got the roots, your basic sciences like anatomy, physiology, genetics. Way up top, you have the lush branches, the clinical specialties like surgery and cardiology. But right there in the middle, supporting the whole shebang and connecting the roots to the branches, is the vital trunk, and that is pathology.
Put simply, pathology is the ultimate bridging subject. It literally connects our foundational knowledge of how the human body is built and how it functions right directly to clinical practice. So when a patient shows up with symptoms, it's pathology that allows a physician to cross that bridge from just understanding the normal body to actually diagnosing what's gone wrong.
Section 2. Branches of the tree.
Because pathology is just such a massive field, it actually splits into highly specialized tools for our medical detectives to use. First up is histopathology and cytopathology, which is all about examining structural changes in diseased tissue. Detectives here are looking at tissues with the naked eye or under a microscope to spot anything abnormal. A really neat technique they use is called FNAC, or fine needle aspiration cytology. Basically, instead of doing a major surgery to get a sample, they use a tiny needle with suction pressure to collect single cells. It's fast, minimally invasive, and just incredibly effective.
Next up, we have clinical chemistry. If histopathology is about looking at physical structures, clinical chemistry is all about looking for the chemical clues left behind by a disease. Our detectives here are investigating metabolic disturbances by assaying or, testing various normal or abnormal compounds floating around in blood, urine, spinal fluid, or stool.
The third branch is microbiology, which is basically a microscopic manhunt. This branch focuses entirely on hunting down infectious invaders hiding out in body fluids and tissues. Using cultures, molecular techniques, and microscopes, these pathologists detect and identify the specific bacteria, viruses, or parasites responsible for making someone sick.
Finally, rounding out our four main pillars, we have hematology. This specialty is dedicated entirely to investigating abnormalities of the blood cells and their precursors inside the bone marrow. So together, these four branches, histopathology, clinical chemistry, microbiology, and hematology, they form this closely interlinked web of investigation that literally leaves no stone unturned.
Now, when you actually study pathology, it's usually broken down into two main approaches, general versus systemic. Think of general pathology as the overarching rules of the game. It deals with common changes that can happen in all tissues, like basic inflammation or how tumors grow. Systemic pathology, on the other hand, gets highly specific. It looks at changes in specific organs and body systems. So learning about inflammation as a concept is general pathology, but studying a specific goiter in the thyroid or a breast cancer tumor, that's systemic pathology.
Section 3. Uncovering the causes. So, when a patient is sick, how exactly do we figure out what went wrong? Well, let's move to see how this builds into a strict, chronological protocol with four core aspects. First, we have step 1, etiology. What's the root cause? Then step 2, pathogenesis. By what exact mechanism did this cause develop into a disease? Step 3, morphology. What physical, structural changes did this cause in the body cells? And finally, step 4, functional consequence. Because the structure changed, how has the function of the organ been compromised? This step-by-step logical flow is absolutely the backbone of disease investigation.
Let's zoom in on that very first step, etiology, or the cause. Suspects generally fall into two distinct categories, genetic or acquired.
Genetic causes could be congenital, meaning they developed during fetal life, like the devastating birth defects historically caused by the drug thalidomide. Then we have acquired, environmental causes. These can be nutritional, physical agents like trauma, or chemical agents. For instance, a poison like cyanide, or even liver toxicity from taking way too much paracetamol, often called PCM. It also includes infectious agents like HIV or malaria, and even immunological and psychological factors.
Now, what's really interesting about this slide is that the relationship between causes and diseases isn't always a simple one-to-one ratio. Sometimes, yeah, one agent causes exactly one disease, like the malaria parasite causing malaria. But sometimes, several agents conspire together to cause just one disease, like diabetes, which is highly multifactorial. And then on the flip side, sometimes a single destructive agent, like smoking, can radiate out and cause a whole bunch of several different diseases, from lung cancer all the way to heart disease.
Section 4. How diseases develop. Okay, once we've identified our suspect, we need to track their modus operandi. How do they actually pull off the crime inside the human body? Well, this tracking process is called pathogenesis. It's the exact sequence of events from the very initial stimulus right up to the ultimate expression of the disease. Pathogenesis tracks the step-by-step molecular, chemical, and structural development. It is literally the story of the disease unfolding in real time.
And as that disease unfolds, it alters the landscape of the body. We call this morphology. Morphology provides the physical clues left behind at the microscopic crime scene. When a histotechnologist prepares a slide and looks under a microscope, they're hunting for these morphologic changes. That could be the chaotic cellular growth of a tumor in cancer, the tissue crater of an ulcer caused by infection, or the shrinking of brain tissue, which is known as atrophy in dementia.
All of this leads us to a highly practical clinical question. Why does a malaria patient have a fever? Why don't they have diarrhea instead? The answer lies entirely in the specific pathogenesis and morphology of the malaria parasite attacking red blood cells, rather than the gastrointestinal tract. Understanding this internal pathology is the only way a doctor can accurately dictate a patient's treatment and predict their prognosis. You simply cannot treat what you don't fundamentally understand at a cellular level.
Section 5. Cellular adaptation.
For our final segment, we're zooming all the way in, past the organs, straight to the microscopic heroes of our story, the cells themselves. So the crucial point is that our cells are not just passive victims waiting to be injured by disease. When faced with non-lethal stress, they undergo what's called cellular adaptation. These are reversible physiologic and structural responses. The cells literally alter their own structure and function just to survive a changing hostile environment.
Notice these key features. Whether the stress is physiological, like your muscle cells growing larger from weightlifting, or pathological, like heart cells expanding to pump against high blood pressure, the result is an altered cell state. But the most amazing part, the viability of the cell is preserved. Adaptation is this incredible intermediate state where the cell is no longer normal, but it's not yet injured or dying either. It's bridging the gap between health and cell death, fighting hard to keep you functioning.
Which leaves us with a truly fascinating question to ponder. If pathology dictates the ultimate prognosis of our health, and our cells are constantly adapting to the stresses of our daily lives, what microscopic clues are your cells leaving behind right now? Are they healthy? Are they adapting to stress? Or are they inching toward injury? The medical detectives of pathology are the only ones who can read that hidden story. Thanks for joining me on The Explainer. Keep wondering, keep learning, and I'll catch you next time.